Hi everyone, and welcome to CT Style Express. I'm Jalene Andrews. If you or someone you know is struggling with knee pain, it might be time to seek advice from a medical professional. Joining us now is Dr. Brandon Prioreschi, an orthopedic surgeon with Middlesex Health. Thanks for being here.
Happy to be here, Jillian. Thanks for having me.
Sure. So let's start off with what causes knee pain?
There are a lot of different causes for knee pain. Things from torn ligaments to meniscus to arthritis. All can be due to injuries or just general wear and tear.
Sure, and a way to deal with this pain is potentially having surgery. How do you know if you're a candidate?
Really getting in to see a specialist is the way to determine if it's something that needs or would benefit from surgery. Many of the common knee injuries tend to get better on their own with a little bit of rest, ice, some over-the-counter anti-inflammatories. If those don't get better, seeing your doctor and getting in to see an orthopedic specialist is a reasonable option to go through what treatment options are available to improve that pain.
So maybe start with seeing your doctor, maybe trying to see if medicine can fix it. If not, then looking into surgery.
Certainly. Surgery is always the last and worst option.
Okay, awesome. So now, what is recovery like for this type of surgery?
So if you're talking about a knee replacement, either a robotic or a manual knee replacement, it really takes about a full year to completely recover. Thankfully, about 90% of that recovery happens in the first 90 days. Patients are up and walking on the knee the same day as surgery, usually with a walker or a cane for the first few weeks. Going to the grocery store, life feeling more normal around 6 weeks. But it takes a full year to get the strength and activity back to where you want to be.
So that's definitely something to consider. It will take a while to feeling like yourself again.
Certainly. It's major surgery. We've had a lot of advancements over the years in how we do this with pain control around the time of surgery and trying to make it more comfortable with nerve blocks and local anesthesia and some nerve freezing procedures, but it's still major surgery that takes a lot to recover from.
Absolutely, and many people might think that knee surgery is mostly for older people, but that's not necessarily the case?
Certainly not. We see a lot of patients with ligament injuries or meniscal tears who are younger, and more with people who have had sports injuries. We'll see arthritis even in younger patients who don't need to wait until they're 60 to have their knee fixed. If you have terrible knee arthritis and you're in your 40s and it's taking away your quality of life and your productivity, it's reasonable to consider a knee replacement at that point. Our newer materials and surgical techniques can give you a knee that will last you 20, 30 years.
All right, but you say no matter what you're feeling in your knees, the best option is to ask questions and not to be afraid to ask any questions.
Certainly. You're going to be seeing a specialist who deals with this day in and day out. I try very hard to go over all the details around surgery, but there are things that I see as routine that I may forget to mention. And so anything that you feel is important, whether it's a trivial little question or a major one, make sure that you ask it, because that will set you up for a more successful recovery and a better understanding of what you're getting into.
Absolutely. And where can we go to learn more?
So there are a lot of resources out there. My practice has a website through Middlesex Orthopedic and Spine Associates that has a lot of go-to baseline information. The American Academy of Orthopedic Surgeons also has a website with a great deal of patient-specific literature that can go over hip, knee, back, shoulder problems at a fairly easy, readable level.
Okay, and that is middlesexhealth.org/ortho. Thanks for being with us today, doctor, and for all your advice. And thank you for watching this edition of CT Style Express. We'll see you next time.